So I was recently reading a article about the value or benefit of maybe taking protein in elderly people before bed to help with muscle recovery at night because the basis of that is, well, sleep is really important for muscle recovery and protein synthesis and can be really helpful in maybe the vulnerable old who are aging and losing that muscle integrity and strength. They found in that study that it would taking protein before bed is helpful for muscle growth and recovery. Do you recommend, do you ever recommend anecdotally protein or certain type of nutritional supplements or foods to help muscle growth or recovery in general?
Yeah, I'm not as familiar with that topic, but in general, the elderly are at risk for, losing muscle mass. They may be less stable on their feet. And then also there's a higher risk of osteoporosis. And that goes back to one of the risk factors for lower back pain. An elderly person with osteoporosis could just have a small little fall and then they have a fracture in one of their vertebrae in the back. So nutrition is very, very important when it comes to maintaining and optimizing health in the elderly, especially bone mass. So if there is concern over that in the elderly, I would recommend that they go see their primary care physician, get some blood tests done, to assess their nutritional status and see if there are any deficiencies in their vitamins and minerals that they can then address. Continuing with weight-bearing exercise is really important for all of us, but especially in the elderly. It's really easy for a lot of people to get trapped into the cycle of, oh, it's so painful, I don't want to move, I'm just going to stay put, stay sedentary, and then they become less strong, their muscles atrophy more, and then it leads to the cycle of them eventually becoming more frail and prone to falls. A lot of elderly and people in pain may also benefit from aquatic-based exercises. So for people who have difficulty tolerating land-based stuff, say it's too painful to walk, or they're even like using a wheelchair to get around, we find that if we put them in the pool where we eliminate some of the gravity effect, they're actually able to move a lot more. And that aerobic activity is really healthy for promoting that blood flow.
I think they'll enjoy that a lot more too. Kind of goes back to what you're saying about the mind body. Also, probably calms them down, makes them feel less, powerless sometimes. Because I do think you do get into the trapped mindset that I just have to live with this pain now. It's just part of who I am, and perhaps there is a benefit to having a good mindset about it. Accepting it rather than seeing it as something that's a barrier, but just trying to live with it in a more positive way. I suppose I just see a lot of people who just accept that the lower back pain is just going to be with them forever. And that mindset, I can imagine how depressing that could be. Could fall into a depression in that sense.
Yeah, generally our mindset as pm&r or physical medicine rehab doctors and also pain medicine doctors is to equip people with everything possible to give them the highest level of function to enjoy their lives. So sometimes it's impossible to take away all the pain, but we want to make that pain level tolerable, that they can do all the things they want to do, like, hang out with their grandchildren, go on walks with their family, go shopping at the grocery store, cook dinner for their family. We don't want pain to be that limiting factor. And I would never want to say that that's it, that is like the life that they are destined towards. There's always something we can do. And I think that just starting small with the help of a physical therapist or occupational therapist it can be really helpful.
I'm curious, do you also have like a different conversation with people that are overactive, like on the other end of the spectrum?
Yeah. So in our sports medicine clinic, we take care of a lot of endurance athletes and a lot of long distance runners. And what we find is that a lot of long distance runners, and especially women, are really prone to having a low bone density. And they can be at risk for stress fractures. And a lot of times these stress fractures may be in their sacral area, so their lower back, pelvic area. And that's when we really need to understand the underlying mechanism. We need to get some blood levels to see what their levels of like calcium, vitamin D, different bone factors are, and be able to address those. So yeah, we do see a lot of people who put their bodies at risk from overuse. Also, there are people who say, a lot of people in the Bay Area love cycling, including myself. And recently I had an issue with a lower back muscle strain. And, I go cycling all the time, and I wasn't even cycling that hard, but boom, I felt like a little bit of low back pain and, the side of my spine, maybe like 2 inches away from midline. So I knew it was a muscle strain. And I would say that, all of us through our physical activity, we are at risk for stuff like this happening, but it's better to be physically active and maintain that muscle strength and deal possibly with these episodic periods of pain than to just be inactive and deal with a much worse consequence, which would be, cardiovascular, poor health, and you're at risk for so many other things.
Yeah, I think that gives light to the saying that sitting is the new smoking, which is sort of the new sort of pandemic taking place in our society right now. And when you wear orthotic shoes or when you sit on orthotic chairs or sit on orthotic recliners, is that helping fix and realign your spine, or is it just symptomatic control?
I would say it's probably more symptomatic control. In terms of realigning your spine, yeah, it's placing your spine in a really beneficial neutral position, but your spine is still just as flexible and getting out of alignment when you don't use that orthopedic chair or when you're not wearing your orthotic shoes. So generally it's about making sure you have that good alignment. Now you understand what it feels like, so that's good. You know that you can feel better, and then it's about engaging your muscles to be able to maintain that posture after. It's kind of like the same philosophy behind bracing. So a lot of patients will be like, oh, I just really want to wear that back brace because that makes me feel so much better. But when you wear that back brace, you're actually promoting a lot of muscle atrophy. So now you're dependent on that back brace to maintain your good posture. When you take it off, you're screwed. So it's a lot better to learn how to engage your muscles to basically do the purpose of the back brace so you don't need to wear it.
So you're saying that although it can feel really good to, and find relief in wearing orthotic shoes or sitting in an orthotic chair, that's not necessarily helping you
The long-term goal.
fix the problem in the long term.
Yeah.
Correct. Yeah, it's really good for symptomatic relief. And say you're having so much pain you can't sleep, I'm all for like having these chairs and beds and stuff. But really, it's about training your body to not need all these external supports.
So if you incorporate like strength course training, is that sort of what's really, the combination of strength training and exercising in addition to these things? Would you say that's more preventative?
Yeah, yeah. Because you're teaching your body how to maintain that neutral spine alignment that would otherwise be happening when you're in your orthopedic chair. When I was little, I think we all thought core exercises was doing sit-ups and crunches, but that's probably not very beneficial actually. So it's really about maintaining those planks and the bridges. And then also on your back, bring your arms and legs forward, all that sort of stuff, because that's using your like lower spine and your pelvis. It's not all about your anterior abs. They may look good in a model, but it's not doing very much functionally for you as you're going around your everyday activities. I used to take an integrative medicine course, and our chiropractor would have us take what he called Brugger breaks. And the Brugger breaks were basically where you stand up, you tighten all your muscles, you bring your arms out to the side, you basically just flex in that position just for like 5 seconds, 10 seconds, and then you go back to what you're doing. And just that act of tightening your muscles, engaging them, would enable us to feel more energized.